Yukon has declared a substance use health emergency. The territory right now has the highest overdose death rate in the country, with 48 in every 100,000 people dying from an overdose. According to the territory's chief coroner, 4 people have already died from an overdose this month alone. Another 3 deaths are being investigated. That means Yukon has seen more overdose deaths this month than it did in all of 2019.
These numbers stagger. The realities of these deaths overwhelm. And all of these deaths were preventable. They were preventable. This is unacceptable in anyone's world, by anyone's definition.
Yukon's health minister joins us now, Tracy-Anne McPhee. She is in Whitehorse. Ms. McPhee, thank you so much for making time for us. Staggering and overwhelm, the 2 words we heard there. I don't think anyone would argue that those words are absolutely appropriate. Declaring what you did today, how does that change the response to the crisis? What extra powers do you have now to wade through this?
Well, thanks so much for your questions, and thanks for your interest in this really serious matter here in the territory, but really across Canada. We are experiencing far too many folks struggling, far too many folks who urgently need help and support. And our declaration today is for a number of purposes, not the least of which is to show our commitment and priority to this matter as a government, to organize a coordinated approach with many partners across the territory. It is a call to action for our government and a call to action to all Yukoners to help respond. We must rally around our communities and our friends and our neighbors, our family members who need support. It is time that we shift the focus to make sure that this is properly described as a health emergency, and we carefully chose a substance use health emergency to encompass a number of problems, opioid drug use, but alcohol, other drugs. Whether it be overdoses or suicides, they must stop. We must rally together and work as a broad community. We had much support on the announcement that we made this morning. First Nations governments, municipal governments, our MP, other partners, folks with lived experience, experts in the field like Blood Ties for Directions, and others who will help us move forward with real responses to what is a crisis and a truly heartbreaking, devastating situation here in the territory.
So support for the announcement, as you say, but I wonder why the decision to do this comes now. In November, the coroner reported the territory had the highest death rates in the country. So why wait?
It wasn't about waiting. It was about attempting a coordinated response. We had hoped, we had in early December a meeting with all of the Yukon First Nations. It's called Yukon Forum. We have it, our government meets 4 times per year with that group. We had a discussion at the Yukon Forum about health emergency, how to go forward together, how to respond. We had hoped to have here in January a mental wellness summit, which was announced and in coordination with the Yukon First Nations was to be done here in January. Of course, our response to the Omicron virus and the COVID-19 virus has required us to not be able to do that in person. I had full expectations that a conversation about declaring a health emergency would happen there, and full expectation that we would be able to come up with a plan together at that broad opportunity. That's not going to happen now, and we cannot wait any longer. This required bold action, required important leadership, and I took the step today to make sure that I could gather the partners that we need to respond, to have a full community response here in the territory, and felt very strongly in consultation with the coroner, our chief medical officer of health, other partners, including the RCMP, that I could not wait any longer. And with the support of a number of partners that I've mentioned, decided to make this declaration today so we can move forward.
Well, let me ask you, as you mentioned, this is an issue in varying forms across this country. What is driving it where you are?
I wish I knew the answer to that question. We're taking the approach that certainly prevention is a key part of the work that we need to do going forward. The acting CMOH was asked about that today. We do have a residential school legacy. We do have too many people struggling, too many people facing challenges that involve drugs and alcohol here in the territory. Don't want to say it's only residential school, but there is a legacy there. The location of the children's bodies last fall caused much grief. I know that people are struggling with the COVID-19 and the restrictions that have been put in place. We have a number of northern challenges that don't necessarily face all Canadians. Weather, darkness in the winter, freezing cold temperatures to a great extent that cause folks to be isolated, as well as the COVID isolation. So I think there's a number of things. We have a unusually high alcohol use in the territory, which I think is historical. And I wish I knew the answers to all those questions, because getting at the
it's a multi-layered. I think all of the things you listed indicate why it's a problem right across the country as well. There are many, many layers to why people turn to different methods to cope. I did want to ask you before we let you go, Absolutely. Minister, will expanding supervised consumption sites to Indigenous communities be something that you're going to be looking at to address? I understand there's only one supervised consumption site right now, and that's in Whitehorse, which opened in September. So is that going to expand as part of the strategy?
It's not likely to. We have very small communities otherwise, but we are going to expand into the communities the opportunity for testing of drugs, which happens here in Whitehorse in a number of ways at the supervised consumption site, as at other sites. We'll be expanding that. Three of the most recent deaths have occurred in our emergency shelters. So we'll be expanding services there at the emergency shelter so that there are people on hand day and night to help individuals who might be considering using drugs. Could they be tested? We're urging people to not use alone. We're urging people to use in the company of naloxone cases and more than one set, because we know that there's currently a strain of drugs here in the territory that is laced with benzodiazepines, and the naloxone or one naloxone kit doesn't always serve to save someone if an overdose is occurring. So please be with friends. Please reach out to others and make sure that we're supporting people who are struggling with these addictions. Really
quickly, Minister, members of the federal government watch our program. What would your message to them be right now? What do you need to see from them?
That's fantastic. We had MP Hanley on our call today and has been supportive. I know he will bring this matter to Parliament. I know I will be speaking with my counterparts and other federal ministers to help. We need to deal with the concept of tainted drugs and how we can expand the services for safe supply. There are people who want to do that, who want to have access to safe supply, and it's restricted now to prescriptions only, and we need to talk about how to do that differently. We also need to expand treatment services.
Minister McPhee, thank you so much for your time.
Thank you very much for your interest.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.